In the next few minutes, approximately 20 seniors will receive a dementia diagnosis. This happens every 66 seconds across the nation. Yet the most shocking revelation isn't about aging itself, but what might be hiding in your daily pill routine. Recent scientific discoveries reveal that 99% of older adults remain unaware that common medications in their possession could reduce critical brain regions by over 28% within 12 months. The pharmaceutical sector has possessed this knowledge for years while generating enormous profits from these same cognitive-threatening substances. A groundbreaking 2023 investigation published in Neurology and Aging Research demonstrated that specific drug categories elevated dementia probability by 49% among seniors using them for just 2 years. Today we'll expose 9 extremely hazardous medications that trigger accelerated memory deterioration and cognitive decline, organized from frequently overlooked to brain devastating. The third entry gets prescribed to countless individuals for seemingly innocent conditions. Yet it systematically destroys essential memory structures without patients realizing the damage occurring. Share in the comments what daily medications you're currently using and whether you've experienced unexpected mental cloudiness or memory lapses. We personally review and respond to every comment with tailored guidance. Your participation could protect your cognitive future. Let's begin with number 9, and its ranking shouldn't minimize the threat, since this medication occupies nearly every senior's medicine collection while potentially scrambling neural networks before symptoms emerge. Number 9. Diphenhydramine. Diphenhydramine represents that familiar pink tablet millions depend on for sleep assistance, allergy management, or cold symptom relief. It's affordable, readily available, and likely sits in your bedside drawer currently. While you believe you're simply improving rest quality or controlling allergic reactions, this substance actively disrupts your hippocampus, the brain area responsible for creating fresh memories. Diphenhydramine belongs to anticholinergic medications that obstruct acetylcholine, a vital neurotransmitter enabling memory formation and mental alertness. Aging brains increasingly depend on every available acetylcholine molecule, making this interference particularly destructive. Research from 2023 in the Journal of Geriatric Cognitive Health revealed that seniors regularly consuming anticholinergic substances faced 54% higher dementia risks versus non-users. Protection strategies include eliminating anything containing diphenhydramine, particularly products labeled PM, nighttime, or allergy formulations. For allergic symptoms, consider newer non-drowsy alternatives like loratadine, commonly marketed as Claritin, which doesn't penetrate brain barriers and proves much safer for extended senior use. Number 8. Proton pump inhibitors. Prilosec and Nexium represent proton pump inhibitors designed to decrease stomach acid production for treating heartburn, GERD, and acid reflux. Many seniors continue using them for years or decades because symptoms resurface upon discontinuation. However, these medications interfere with vitamin B12 absorption, a crucial nutrient protecting brain function and supporting memory, concentration, and emotional stability. A 2016 study in JAMA Neurology, examining over 73,000 individuals aged 75 and older, discovered that regular PPI users experienced 44% increased dementia risk compared to non-users. Aggressive acid suppression prevents proper absorption of B12, magnesium, and calcium, all essential for neural transmission and brain cell communication. Without these nutrients, neurons struggle with efficient firing, causing confusion and memory problems resembling early Alzheimer's symptoms. PPIs also elevate amyloid beta plaque levels, toxic brain proteins that disrupt function and drive Alzheimer's progression. Safer approaches include gradually tapering off PPIs using H2 blockers like famotidine, sold as Pepcid. Additionally, deglycyrrhizinated licorice naturally coats stomach lining for symptom relief without cognitive consequences. Number 7. Bladder control medications. Oxybutynin, marketed as Ditropan, gets prescribed for urinary incontinence or overactive bladder issues. While addressing embarrassing bathroom urgency seems practical, this medication blocks acetylcholine like Benadryl, but crosses brain barriers more readily, directly affecting hippocampal memory regions. This makes it especially dangerous for seniors during extended use periods. BMJ research from 2019 found that adults over 65 taking strong anticholinergics like oxybutynin for over 1 year faced 49% higher dementia risks. Many seniors never receive warnings about cognitive side effects, only hearing about bladder control benefits while remaining unaware of potential mental decline acceleration. Symptoms like mental fogginess, missed appointments, misplaced belongings, or conversation tracking difficulties rarely get connected to medications until significant damage occurs. Newer alternatives like mirabegron, sold as Mirbitriq, operate through different mechanisms without blocking acetylcholine and demonstrate significantly reduced memory impact. Number 6. Statins. Statins rank among globally prescribed medications, especially for individuals over 60, intended to reduce cholesterol and prevent heart attacks or strokes. Simvastatin and atorvastatin, marketed as Zocor and Lipitor, represent common examples. However, cholesterol serves brain necessity beyond heart concerns. Brain composition includes nearly 60% fat, with cholesterol playing key roles in creating and maintaining myelin sheaths that protect nerve signal transmission. Aggressive cholesterol reduction may starve brains of essential functioning components. Frontiers in Aging, neuroscience research from 2023 showed seniors over 70 using statins for more than 3 years had 26% higher mild cognitive impairment risks, with high-dose users experiencing more pronounced declines. Some patients reported sudden memory loss episodes where they couldn't recall names, recent conversations, or familiar routes. Different statins affect brains unequally. Pravastatin and rosuvastatin cross brain barriers less easily, making them less cognitively risky. If experiencing fog, forgetfulness, or confusion while on statins, discuss dose reduction or alternative strategies with physicians before damage becomes permanent. Number 5. Benzodiazepines. Benzodiazepines, including lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax, get widely prescribed for anxiety and sleep disorders. They enhance GABA, the brain's calming neurotransmitter that reduces overstimulation. Initially appearing life-saving by quieting minds, easing panic, and promoting sleep, these drugs eventually become problematic traps. 2022. BMJ research following over 8,000 seniors across 6 years found that benzodiazepine users for more than 3 months had 51% increased Alzheimer's risk. Long-acting forms like diazepam pose greater risks by remaining in bodies longer and accumulating in fatty tissues, including brain matter. This creates chemical sedation that slows neural activity, making brains less adaptable, efficient, and more prone to confusion and memory gaps. Correction requires careful medical supervision for gradual dose tapering, never sudden discontinuation. Alternatives include buspirone for non-sedating anxiety relief or cognitive behavioral therapy for insomnia and anxiety management. Number 4. Amitriptyline. Amitriptyline, sold as Elavil, represents an older antidepressant still commonly prescribed for pain, insomnia, and migraines. Despite appearing as a versatile solution, it's among the most potent anticholinergic medications available, strongly blocking acetylcholine and making cognitive effects expected rather than possible with extended use. Massive 2015. JAMA Internal Medicine Research, examining over 3,400 adults aged 65 and older, found that higher cumulative anticholinergic medication doses over 10 years created 54% greater dementia chances. Many patients prescribed amitriptyline for sleep or nerve pain gradually noticed short-term memory loss, word-finding difficulties, and concentration problems without connecting symptoms to medications. Safer alternatives include duloxetine or gabapentin for nerve pain, melatonin or low-dose doxepin for sleep, and sertraline or escitalopram for mood support. Number 3, paroxetine. Paroxetine, marketed as Paxil, represents commonly prescribed selective serotonin reuptake inhibitors for depression and anxiety. Unlike other SSRIs, paroxetine possesses significant anticholinergic properties that interfere with brain acetylcholine, making it drastically different from siblings like sertraline or escitalopram. 2021. Frontiers in Psychiatry. Research examining elderly patients taking different SSRIs found paroxetine users showed measurable short-term memory, verbal recall, and attention span declines within 12 months. Seniors on paroxetine were 30% more likely to display early cognitive impairment signs compared to other antidepressant users. The American Geriatric Society includes paroxetine on its Beers criteria list of potentially inappropriate medications for older adults. Safer SSRI alternatives like sertraline or escitalopram provide better tolerance without cognitive risks. Number 2, antipsychotics. Many seniors unknowingly take antipsychotic medications. Drugs like quetiapine or Seroquel, risperidone or Risperdal, and olanzapine or Zyprexa, originally developed for schizophrenia and bipolar disorder, now get prescribed off-label for sleep problems, agitation, or dementia-related behavioral changes. These severe psychiatric illness medications are being used for seniors who are simply confused, restless, or difficult to manage. 2022. Lancet Healthy Longevity Research, following over 25,000 older adults, found seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within 12 months. These medications suppress dopamine, critical for executive function and memory processing, causing brain sluggishness and unresponsiveness. Non-drug interventions can often manage behavioral symptoms through structured routines, reduced overstimulation, pain management, and improved sleep hygiene. When medications prove absolutely necessary, lower doses for shorter periods reduce harm. Number 1, anticholinergic polypharmacy. The most dangerous threat involves taking multiple anticholinergic medications simultaneously, creating cumulative anticholinergic burden. Consider seniors taking diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain. Each alone may cause mild memory problems, but together they compound devastatingly. 2022. Age and Aging Analysis, tracking over 280,000 older adults, found those with highest anticholinergic burden had 120% increased dementia risk within 10 years. Most seniors remained unaware they were taking anticholinergic medications. Blocking acetylcholine from multiple angles causes brain decay, as neurons wither from underuse and synapses shrink. Correction requires comprehensive medication reviews to identify anticholinergic load, followed by deprescribing unnecessary medications and switching to safer alternatives. Drug-induced dementia often proves reversible. When burden lifts, many seniors regain clarity, energy, and memory function within weeks or months, demonstrating brain resilience when given opportunities to recover. Share your medication experiences and whether you'll discuss reviewing your prescriptions with healthcare providers this week. Your engagement helps build awareness about these critical cognitive threats facing our aging population.